Welcome to Rawmana Fitness. My name is Siaosi. Today's date is December 16, 2012. It's about 5:30 in the morning. Just want to give you a little update on what's going on here at the studio. About a month and a half ago, I had some issues with my lungs and went into the doctors and had a few tests. Discovered that I had some scarring on my lungs. Blood tests all came out well. There's no cancer. Yet there is scarring. So they decided that they were going to go in and do the biopsy and remove a portion of my lungs and take it in for some testing. It was sent out to 3 different specialists. It all came negative. So in other words, they have no freaking idea what's going on with my lungs and what caused the scarring. But basically, what I'm trying to do now is move forward with my life and try to get my life back in on the right track. And I just kind of wanted to showcase what was going on. So within a month and a half, I lost about almost 15 pounds. Those 15 pounds that I lost, who knows what part of it was fat. I didn't measure myself, and I didn't take the hydro. I should have taken the hydrostatic body fat testing before I did my test, but I didn't. It was unimportant at that time. But I just kind of want to show. So here's what's going on with my stomach. The surgery was done from the side, 2 on the sides and 1 in the back somewhere, where they went in and removed the left side of my lung. On this side of my abdomen, you can notice that this muscle is larger. Basically, for the last month and a half, I had no feeling from this side, from my chest down here. I'm just now starting to feel a little bit, and yet you can see the difference on this side, how this one has maintained, and yet this side is kind of lost a lot. So for the next month or next month and a half, I'm going to try to rebuild what I have left, and see if maybe I can help the feelings come back. I know it's supposed to come back on itself. But I'm just hoping that within just, getting through regular activities, that I can rebuild the muscles faster than most people. It's been a journey. It's been an awesome journey. It's been a learning experience and an eye-opener to have something like this happen to me. And it just shows how important it is for people to keep their health in check and being proactive in everything that they do. Because you don't know, you can't take things for granted. Your health is one of the most important things that you can value and keep. Families and friends are all part of it. So I'm hoping somebody will take this little note and take it to the next step and enjoy your health and take care of your health and take care of the one that you love, because you don't know. You really don't know what would happen to you within time. I went from running 10 miles a day to being unable to run at all. My saturations, I can go from 6 minutes. I can go from having 99% of oxygen in my body down to 88%. What I was able to do 2 months ago, I can no longer do. Yet I'm going to try to maintain what I have at the best of my ability, and not having the doctors tell me that I can't do things that I love. I know that I have to modify what I have to do. Yet I think they're wrong. I think that I will be okay. I think that I'll push through this and get it done. So I'll give you an update probably a month from now and what's going on, and hopefully I'll be able to run a mile without non-stop. As of right now, I can only walk at 6 minutes. Okay, I'll talk to you soon. Bye.